How's it going, guys? Can you hear me okay? All right, it's 9:01. I am here. You guys are here. We're going to get started. And I see less and less people coming in. That's how it goes. All right, guys. So today we're going to start a new chapter, chapter 4. And chapter 4 is the first chapter we're going to be discussing that is going to be related to an organ system. Folks, this is a milestone right here. From this point on, every chapter that we go through is going to cover a organ system. So we're going to start with integumentary system today, and then the last chapter we're going to cover, chapter 16, is going to be about the reproductive system. Okay? So we're going to go about halfway through the chapter 4 today. Then we're going to finish this next week, Tuesday. And just to remind you once again, our first exam is coming up next week, Thursday. Okay, we are a week away from our first exam. And keeping in mind that you need to have your camera on in order to take the exam because the exams are closed book. Okay? Does anybody have any questions? Any issues, any problems, anything at all? All right. So let me share my screen with you. And let's talk about the skin. Now, what are we going to be discussing in this chapter? We're going to be discussing about the types of body membranes. Okay, that's what we're going to introduce with that. Then we're going to talk about our skin and hair. What are they made of? What are the structures that we find within our skin, within our hair? What are the different layers within the skin? And then I want to talk a little bit about what happens when an individual gets too much sun. Okay, what is a sunburn? What causes a sunburn? And I also want to talk about skin cancer in this chapter right here. Especially relevant for us that live in a place like Hawaii, in which we have very high UV exposure. It's very important for us to understand the two main types of cancer. One that is very, very aggressive, and I'm going to explain what aggressive means in terms of cancer, and the other one that is much more less aggressive and deadly. Okay? And then we need to be able to differentiate between those two different types of cancer. Because the number one rule of cancer, in order to help prevent someone from dying of cancer, is to discover the cancer early enough. The earlier the diagnosis of a cancer, guys, the greater the chance of survival from that cancer. It doesn't matter what cancer it is. If you catch it early enough, your chances are much greater than if you catch it later. Okay? So let's go over the types of body membranes first, and then we're going to get into the skin and the hair. And we have 4 different types of body membranes. Not to confuse them, folks, with the 4 different types of tissues. Does anybody remember what are the 4 different types of tissues? We just talked about it on Tuesday. Help me out here. What are the 4 different types of tissues in the body? I'll give you one. Epithelial. What are the other 3? Come on, help me out. We just talked about it.
The connective tissue.
Say it again, Jamie.
Connective tissue.
Connective tissue is another one. What are the other 2? Let's see here. Nervous, yes. One more. What is the 4th one?
Muscle.
Muscle, absolutely. And guys, again, this is stuff that I'm asking you because we have discussed about it in class. Okay? So it is stuff that you need to know for the exam coming up a week from today. So the 4 different types of tissues in the body are epithelial, connective, muscular, and nervous. Now, we also have 4 different types of membranes. And membranes, they cover our body somehow, okay, some part of our body. So one of those body membranes is what we call the synovial membrane. Where do we find the synovial membrane? Synovial membrane is found in our joints. Okay, and what the synovial membrane, what is it going to do is that it's going to create a little capsule surrounding our joints. Okay, now the synovial membrane here, they have specialized cells called the synovial cells, and the synovial cells, they make a fluid. Take a wild guess, the name of the fluid. Synovial fluid. Where is this fluid going to be found, guys? The fluid is going to be found in between the joints right here, in the space within the joints. What is the function of that fluid? The fluid helps to lubricate our joints. Do you know what happens when we get older? As we get older, the amount of fluid that is produced by the synovial cells decrease. And this is why when we are older, our joints start to crack and make a lot of noise when we're walking, and that is because of the decreased lubrication in the joints. Then we have a mucous membrane. Where do we find the mucous membrane? We find the mucous membrane that is lining the organs that are exposed to the outside environment. What do I mean by that, guys? Our respiratory tract, our digestive tract, they are all exposed to the external environment. So covering the inner lining of the respiratory tract, covering the inner lining of the digestive tract, we are going to find the mucous membrane, also called the mucosa. Then we have the serous membrane, and the serous membrane, also called serosa, is going to line the body cavities that are close to that external environment. For example, the cavity of our lungs, the cavity surrounding our heart, the cavity surrounding our brain. So those body cavities, they have a membrane called the serous membrane or serosa. Remember when we talked about the double-layered membrane around the heart, right? And that membrane is what we call the pericardium membrane. Well, the pericardium membrane is a type of a serous membrane. And then we talk about the pleural membrane that surrounds our lungs. The pleural membrane is a type of a serous membrane. And finally, we have the cutaneous membrane, and the cutaneous membrane is our skin, okay, which we're going to be talking a lot more about today. So, I have mentioned to you this before, and I want to say it again because it's very important, is that several body cavities, they are lined by serous membrane, and they are made of a double layer. Okay, the layer that is touching the organs, the layer that is covering the viscera, and viscera is another name for organ. This is what we call the visceral layer. And the layer that is on the walls of the cavity, this is what we call the parietal layer. So right here in the screen, we're looking at this little cartoon here, and this is showing what we call the peritoneal cavity, aka the abdominal pelvic cavity. And the peritoneal cavity is covered by a membrane called the peritoneal membrane. Now, this peritoneal membrane has a visceral layer, and it has a parietal layer, okay? Now, I also mentioned this in the very first day of class, in which a lot of people, not only students, but the population in general, do not think of the skin as an organ. And I want to change that. I want to give more power to our skin, more attention to our skin, because our skin is the largest organ that we have in our body, both in terms of weight and in terms of surface area. There is no other organ in the body that comes even closer to the size and the weight of our skin. Okay? Now, Remember that the skin, it belongs to what we call the integumentary system, but it's not the only structure within the integumentary system. We're also going to find what we call the glands that are associated with the skin, what we call the cutaneous glands. And within the cutaneous glands, we have the sudoriferous glands that produce sweat, and we have the sebaceous glands that produce oil. And we're going to talk more about them in a minute. We also have the skin, the nails and the hairs. They're all part of what we call the integumentary system. Okay? What are the functions of our skin? Guys, one of the most important functions of the skin is for protection. Protection from what? Look, our skin separates our internal environment from our external environment. It creates the barrier that defines what is inside from the outside. An unbroken skin is a very difficult barrier to be traversed by bacteria or any pathogen. Our skin is also involved with heat loss and heat retention. What happens when we walk outside and we start exercising and it's very hot, guys? We are going to sweat. What does sweat do? Sweat is going to cover our body. It's mostly water, especially sweat that is coming from a gland called the eccrine gland. We're going to talk more about them. But what's going to happen is that all of the water and the surface of our skin, when the sun evaporates that water, it leads to what is called evaporative cooling. It will cool down the surface of our body by evaporating the water, the sweat, from our skin. And again, this is going to help with heat loss. Now, what happens when we walk into a place that is very cold? We are going to start shivering. And shivering is due to contraction of muscles right underneath the skin. And when the muscles contract, they create friction. And friction generates heat. Okay? So it helps with heat retention. Our skin is very important for the synthesis of vitamin D. Now, let me make something clear here. This vitamin D that is synthesized by the skin, folks, is due to the exposure of our skin to the UV light coming from the sun. So when UV light hits our skin, it's going to make the production of an enzyme, a pre-enzyme called vitamin D3. Then this enzyme, this pre-enzyme, is going to pass through the kidneys, is going to pass through the liver, and then they're going to be activated into the vitamin D. Now, can anybody tell me what is one, I'm only asking for one, very important function of vitamin D? Does anybody know a very important function of vitamin D? Let me give you a hint. If you go to your fridge right now and you look at your carton or gallon of milk, you're going to find oftentimes that our milk is enriched with vitamin D. So the question here is, again, what is an important function of vitamin D in our body? Let's see here. Yes, it helps with bones. Specifically, vitamin D allows for the absorption of calcium into our cells, guys. Because look, if you don't have enough vitamin D, all the calcium that you have, that you're drinking, for example, from the milk that you drank, it will go straight through your body. Your cells are not going to absorb them. Your cells need the vitamin D in order to absorb calcium. Okay? And finally, our skin is very important for what we call cutaneous sensation. There are nerve endings at the end of our skin, which is going to help us to sense our environment. Any questions, guys? All right. Now let's take a closer look at the structures of the skin. Folks, I will ask you questions about this in our first exam. In fact, I'm going to be using the same figure right here on the exam, and you need to be able to identify all the different structures that we're going to be discussing right now. Okay? Our skin is made of 3 different layers. We have a middle layer, which is very thick, and that is what we call the dermis. There's a layer on top of the dermis that we call the epidermis. Remember, epi means above, so above the dermis. And then we have a layer below the dermis that we call the hypodermis. Remember, hypo means under, below. And the hypodermis is also what we call the subcutaneous layer. And within the subcutaneous layer, we're going to find a lot of fat, and we're also going to find areolar connective tissue. Okay? Now, what I want to do, I want to take the epidermis only. I'm going to take just the top layer of the skin right here, guys. And I'm going to put this under the microscope so that we can see it better right here. So let's take a closer look at the different layers of the epidermis. All right, going from the bottom all the way to the top. So at the bottom right here, right in between the epidermis and the dermis down below. So if you can look, everybody look up here. So from this point down is the dermis, okay? And from this point up is the epidermis. So right at the line between the epidermis and the dermis, we have a layer of cells called the stratum basal layer. What are we going to find in this stratum basal layer here? We are going to find the cells, folks, that are very, very active, metabolically speaking. They are dividing all the time. We have a lot of stem cells right there. How can we tell that they are dividing? Look at this little cell right here. All of the DNA is right in the middle of the cell. It tells me that that cell is undergoing mitosis. It is in the metaphase of mitosis. Remember, in the metaphase, all the DNA is lined in the middle of the cell. Now, what else are we going to find right here within the stratum basal? We're going to find these little Merkel cells. What are these little Merkel cells? These little Merkel cells are actually cells of the nervous system. What are they doing that, guys? They are making the connection between our skin and the nervous tissue right here. Okay, they allow us, they give us what we call the cutaneous sensation. They allow us to feel things with our skin. Also, I want to talk a little bit about the fact that we are going to find a lot of stem cells in the stratum basum. Can anybody tell me, though, what is a stem cell? Let's start from there. What is a stem cell? I'm sure you guys have heard of stem cell before, stem cell research. What are stem cells? What is so special about them? Does anybody know? Nobody ever heard of a stem cell. Guys, a stem cell, let's see here. They are in the brain. No, not necessarily in the brain. That's not what's special about them, Mateo. But, so I want you guys to write this down. Stem cells are cells that are undifferentiated. What do I mean by undifferentiated? It means that it's a cell that can transform into other cells in our body. When we are a fetus, guys, we are mostly stem cells. And then as the fetus develop, those stem cells are going to change into a heart cell. They're going to change into a kidney cell, into a lung cell, into a brain cell, into a liver cell. Okay, then they're going to become differentiated. So stem cells are cells that can transform, that can change into any cell in the body. When we become adults, the number of stem cells in our body decrease dramatically. We don't have a lot of stem cells left. But there are a few places in the body in which we still find some stem cell. One of those places are right here at the stratum basal of the epidermis. Next, we have what we call the stratum spinosum. And we can see that the stratum spinosum is the thickest layer of the epidermis. What are we going to find? What kind of cell we find in the stratum spinosum? We find lots and lots of keratinocytes. What are the keratinocytes? Keratinocytes are cells that produce a protein called keratin. And keratin is a very tough protein, folks, that gives the toughness of our skin, gives the toughness of our nails, gives the toughness of our hair. We also find the cells right here called the Langerhans cells within the stratum spinosum. And Langerhans cells are cells of the immune system. They can do something called phagocytosis. And we know what phagocytosis is. Phagocytosis is one cell eating another cell. Okay, so they help with our protection. And we're also going to find the melanocytes within the stratum spinosum. What is the function of melanocytes? Melanocytes produce a pigment called melanin. And melanin is going to protect our skin from UV light coming from the sun. That is the function of melanin. Now, of course, melanin is what gives us our skin coloration. The darker your skin is, the more melanocytes you have. Okay? Meaning that more pigmentation you're going to have in your skin. The lighter your skin is, the less melanocytes you're going to have in your stratum spinosum. Next, we have the stratum granulosum. And the stratum granulosum, we're going to find a lot of these lamellar cells, which contains all of these granules, called the lamellar granules. On top of that, we have the stratum lucidum. And then all the way on the top of our skin, we have what is called the stratum corneum. And I want you guys to notice something here, guys. The stratum corneum is made of dead keratinocytes. What am I telling you? I'm telling you that when you look at yourself in the mirror and you think that you are so pretty, you are looking at dead tissue. You're looking at a zombie because the surface of our skin is covered with dead keratinocytes. Okay? Now, what is the purpose of these dead keratinocytes? These dead keratinocytes here, they're going to constantly slosh off from the surface of the skin, and they're going to trap the bacteria that is here, and they're going to get the bacteria off the skin as well. Everywhere we go, folks, we leave a trail of dead keratinocytes behind us. So don't commit a crime. You're going to be caught because you leave DNA everywhere. Okay? Now, our epidermis is avascular, meaning that it does not have any blood supply. And our body is covered in two different types of skin. We have a thin skin and we have a thick skin. The thin skin, which covers most of our body, does not include the stratum lucidum right here, folks. So we don't have stratum lucidum in the thin skin that covers most of our body. Where are we going to find the stratum lucidum? We're going to find the stratum lucidum on the sole of our feet and the palms of our hands. Why? Because we need an extra layer of protection in the palms of our hands and the sole of our feet. Okay? Now, since we're talking about the epidermis, I want to talk about one type of skin cancer out of the two we're going to be discussing in class. One of those cancers is a cancer called basal cell carcinoma. Now, let's look at the word right here, guys, the name of this cancer, basal cell carcinoma. Where do you think this cancer arises? It arises from the stratum basal, hence the name basal cell carcinoma. Now, basal cell carcinoma, and we can see that this individual right here, he has basal cell carcinoma. It's a mild cancer. Most people don't die from basal cell carcinoma. What makes a cancer mild? Well, what makes a cancer mild is the fact that the cancer cells, they do not divide very fast. And number two, the cancer cells do not spread very easily throughout the body. They do not metastasize. Okay, so basal cell carcinoma divides very slow, and basal cell carcinoma is not very good at metastasis. It does not metastasize. It does not spread throughout the body. So oftentimes what people have to do, they're going to go to the doctor. The doctor is going to remove the cancer cells, and it might be the end of it. Maybe they're going to have some radiotherapy, but that's it. The cancer is gone. Okay? Now, let's recap here. Let's take a closer look at the cells of the epidermis. The most abundant cells of the epidermis are the keratinocytes. And again, they produce a protein called keratin. Then we have the melanocytes. The melanocytes make a pigment called melanin. What is the function of melanin? Melanin prevents damage of our DNA by the UV light from the sun. Now, please don't tell me on an exam, for example, that the function of melanin is to give our skin coloration. No, that is a byproduct of melanin. The function of melanin is to protect our cells from the damage from UV light of the sun. So what happens when we go to the beach, guys, and we get exposed to our sun? We get a tan. What is a tan? A tan is when UV light hits the melanocytes and overactivate the melanocytes, which means that the melanocytes are going to produce more melanin. And the increase in the production of melanin is going to give you a tan. Okay? Then we have the Langerhans cells, and the Langerhans cells, they belong to the immune system. They are immune cells. And finally, we have the Merkel cells, and those Merkel cells, they are part of the nervous system. They make the connection between our skin and the sensory neuron. Okay. Does anybody have any questions? All right. Moving on. Let's talk a little bit about hyperkeratosis, also called hyperkeratinization. Now remember, hyper means what? Above, greater than. Keratosis means the production of keratin. So these are situations or conditions in which is going to lead to an overproduction of keratin in the skin. And I'm giving you two different examples of hyperkeratosis. One is caused by a condition called a callus. What is a callus? Callus is due to an increased keratinization, meaning increased production of keratin, and that is due to constant friction at some part of our body. For example, if you wear tight shoes all the time, you're going to get hyperkeratinization or formation of callus on your toes. If you work with your hands, guys, you're going to get callus on your hands. And that is, again, due to overstimulation, constant friction. Okay, so this deposition of keratin, it should help to protect us in those places where there is a lot of friction. Another example of hyperkeratosis is a condition called psoriasis, which is very different from callus. In psoriasis, we're going to have abnormally excessive growth of the keratinocytes, and that is going to lead to the scaling of the skin and the production of keratin on the skin. Now, psoriasis is an autoimmune disease. It is a type of a chronic condition, a chronic disease, okay? All right, moving on. I have $1 million question for you here, folks. Even though I don't have $1 million to give you, it is $1 million question. And the question is, can you turn orange if you eat or drink a lot of carrots? If you eat a lot of carrot or drink a lot of carrot juice? I want you guys to think about that for a minute, and then I want to hear your answer. Everybody needs to have an opinion. So the question is, can you turn orange if you eat a lot of carrots or if you drink a lot of carrot juice? I'm going to leave you in suspense for a minute. But let's talk about our skin color and see what our skin color depends on. What are the factors that changes or contribute to our skin color? Number one, melanin. Remember, melanin is produced by the melanocytes, okay? But the deposition of melanin, it does give our skin a different coloration, even though that is not the job of the melanin. Again, what is the job of melanin? Protecting our cells from damage from the UV light, from the sun, okay? Now, melanin, again, are produced by the melanocytes. A freckle is nothing but a cluster of melanocytes making melanin. What is a tan? A tan is an overactivation of the melanocytes by the UV light from the sun, and that leads to extra production of melanin. And an age spot, also called a liver spot, is just like a freckle. It's also an accumulation of melanocytes making melanin. Okay? Now, an individual that have a condition called albinism, that is due to a very low production of melanin. Not because they don't have melanocytes, guys, but because the melanocytes are defective and they don't produce enough melanin. Now, albinism, and we can see this young little lady here, she has albinism, and we can see how fair her skin is. Guys, look at her hair. Look at her eyebrows. They are completely devoid of any pigmentation. Now, albinism is a genetic disorder. It's not something that you acquire, during your lifetime. You are born with it. It is genetic, okay? Now, as you can imagine, though, having a condition like albinism, that is very, very dangerous. Why is it dangerous? Well, it's dangerous because you don't have any protection against the sun. And any little exposure to the sun, that can lead to the formation of cancer, especially a type of cancer called malignant melanoma. And I want everybody's extra attention here. Guys, different from basal cell carcinoma that we talked about a few minutes ago, malignant melanoma is one of the most aggressive cancers that we know of. What makes malignant melanoma so aggressive and so deadly? Number one, malignant melanoma cells, the cancer cells, they divide extremely fast. Number two, malignant melanoma cancer cells, they can spread throughout the body very easily. They can easily metastasize. And again, those are the two conditions that makes a cancer aggressive. Now, when malignant melanoma metastasizes, one of the first places that it goes to, a preferred place, is the brain. So it's not the primary cancer, folks, in the skin that is going to kill the patient. No, it is the migration, the metastasis of that cancer cell from the skin all the way to the brain. And now in the brain, that cancer cell is going to spread and is going to form a tumor, and that is extremely difficult to treat. And malignant melanoma that is caught late in what we call the stage 4 malignant melanoma is the chances of survival, folks, is about 5% only. The life expectancy of a malignant melanoma patient with stage 4 cancer is about 6 months to a year at most. So the most important thing that we need to do is to be able to catch a cancer like malignant melanoma early enough. And to do that, I want to talk about something called the ABCDE rule of malignant melanoma. In order to help you determine if a spot in your skin is just a normal nevus or a mole, which is benign, versus a malignant melanoma. Okay? So everybody look up here, please. Here we have, on the left-hand side, we have a normal nevus, aka a mole in the skin. On the right-hand side, we have a malignant melanoma. What is the A in the ABCDE rule? A here stands for asymmetry, guys. What does that mean? It means that a malignant melanoma spot is asymmetric. Let's see right here. Let's try to divide this spot right here, this malignant melanoma, into 2 halves. Does this 2 halves look alike? No. Let's try again. Does this 2 halves look alike? No. There is no symmetry in a malignant melanoma. Now, if you look at the nevus right here, it is pretty symmetrical. Now, it doesn't look identical, but there is some symmetry on both halves of the mole. B stands for border. What does that mean? It means that the borders of a malignant melanoma spot is very irregular. Let me show you here for a second. If you come in here and you look at the surface, guys, the border, it looks very irregular, very raggedy. Okay, it goes everywhere. Now, a nevus, it has a more smooth border. Okay, so B stands for border. C, it stands for color. Now, I don't care if your mole is blue, purple, yellow, green, pink. That's not the point here. The point is that a malignant melanoma has different colorations within the spot. Again, take a look at the picture right here. We have regions that are very dark and then regions that are lighter in coloration. So there is no uniformity in the color of malignant melanoma. But if you look at the mole, again, there is uniformity in the color. D stands for diameter. Yes, a mole can be big, but usually a mole is small and it doesn't grow dramatically over a short period of time. The malignant melanoma, it will start small, but then it's going to grow very fast, which comes to the E, which is evolving. A mole will not change dramatically over a short period of time. A malignant melanoma will. You can look at a spot in your skin of malignant melanoma that looks like this in 1 week. 2 weeks later, it could look like this. Okay, it does evolve dramatically and very fast. So this is the ABCDE rule of malignant melanoma. Now, let's say that you have a spot on your skin, you went over the ABCDE rule, and it ruled out malignant melanoma. Should you just relax? Yes and no. you should still, if you're still concerned about it, go see your doctor. A dermatologist is going to look at that spot, and he's going to tell right away if it's something that is benign, like a mole, or if it could potentially be cancer, like malignant melanoma. Okay? If the doctor is borderline, just by looking at it, they're going to do a biopsy, they're going to take a little sample of the skin, and then it's going to send to a pathologist, which is going to look at under the microscope and make a diagnosis. All right? So if you're concerned, still go see a doctor. Any questions, guys? All right. So let's answer that million-dollar question that I posed a few minutes ago. So I want to hear from you guys here. You can just type here on the chat. Can you turn orange if you eat a lot of carrots or drink a lot of carrot juice? Yes or no? Let's see right here. I have a no. Yes, yes, yes. A yes, another no. Trusting the magic school bus. I would say here that the majority is saying yes, you can turn orange. And the majority, again, is correct. So the answer is yes, you can turn orange if you drink a lot of orange juice or if you eat a lot of carrots. You know, but the parents out there, especially first-time parents, they might have come across a situation with their babies, right? When we are first-time parents and we are super concerned about our kids, we just want to give them superfood and we stuff them with carrots and carrot juice. And some babies, they can turn orange for a little while. Now, it's not going to be orange like these guys over here, this Oompa Loompa, or even turn orange like this guy over here. With all due respect, he needs to lay off the tanning salon. But you absolutely can turn orange if you eat a lot of carrots. And the reason for that is because within carrots, there is a pigment, there's a chemical called carotene. And overconsumption of carotene in our blood, it can turn our skin yellowish. Okay? Our hemoglobin is also important for our skin pigmentation. And remember, hemoglobins are found in our red blood cells, and they are the ones that are going to transport the oxygen gas throughout the body. But also, different things, including high blood pressure, a condition called erythema, can lead for us to getting red, and we turn red, especially when we are nervous, right? If right now I ask one of you to, unmute yourself and start singing, most likely you're gonna get pretty nervous. Blanching is caused by a low blood pressure or blood loss, in which the color from your skin kind of disappears, you turn white. Jaundice is the yellowish of the skin due to the increased presence of a pigment called bilirubin, and that is due to a problem with our liver. And bruises, which are damage to the capillary beds, can also change our skin coloration. Okay, so several different things can lead to changes in our skin color. Any questions, folks? All right. Moving on. Now, let's talk a little bit about the dermis. And remember, the dermis is the thickest layer of the skin right here in the middle. And if you can look at the cartoon right here, you can see that the dermis is very busy. There's a lot of stuff. There's a lot of instructions within the dermis. Now, the dermis is divided into two different layers. We have what we call the papillary layer, and we have what we call the reticular layer. Within the reticular layer, which is the main layer of the dermis right here, folks, So this entire section is the reticular layer. We're going to find the muscles. We're going to find glands. We're going to find hair follicles, nerve endings, blood vessel, etc. Now, what is the papillary layer and where it is? The papillary layer, folks, is this layer right here, right between the dermis and the epidermis. Can we see all these different bumps right here? This is what we call the papillary layer. And it's the papillary layer that gives our fingerprints. And we know that every single individual has a different fingerprinting. And that is due to not our genes, but due to the environmental factors within the womb when we are a fetus. And this is why, guys, even identical twins do not have the same fingerprint. So if you have an identical twin, you can ask your twin to commit a crime for you, thinking that, you're not going to be caught. Well, every single individual, including identical twins, have unique fingerprints. Why? Because the fingerprinting, the formation of the papillary layer is due to environmental factors inside the womb. Even identical twins are growing in different locations. They have different pressures from the uterus. There is different flow of amniotic fluid. And that alone will cause the differentiation within the papillary layer. Now, the dermis contains collagen and elastic fibers, including elastin. And it is the collagen and the elastin that gives the elasticity of our skin. Folks, what happens when we get older? When we get older, we start getting sagging skin. We start getting wrinkles on our skin. And that is because of a decrease in the production of collagen and elastin. Okay? Different from the epidermis, the dermis is vascular. And we can see all the blood vessels right here within the dermis. And we are going to find the nerve endings in the dermis as well. What about Botox? Since we're talking about our skin and wrinkles and sagging, let's talk about Botox. First of all, I want to hear from you folks. Can anybody tell me, what does Botox do to someone? When someone injects themselves with Botox, why do they do that? How does Botox help? I know you know this. Help me out here.
Is it like a filler? Like it
A
just
filler.
pushes out the skin?
And that is a common mistake. Botox is not a filler. Filler is actually fat, injection of fat into different parts of the body. Usually, like the Kardashians, for example, they're going to take fat from their butts and they're going to inject that into their lips. So that makes the lips more plump. Or you can inject in other parts of the body. That's what a filler is. That's not what Botox do. Does anybody else? Come on, guys. I know you know this, unless you live under a cave. We know what Botox do. No takers. Guys, Botox, which is just the commercial name for a toxin called the botulinum toxin, let's see here, blocks nerve signals to tell muscles to relax. Yeah, absolutely. So what the Botox do, and again, Botox actually come from a toxin, a bacterial toxin called the botulinum toxin, and this toxin is produced by a bacteria called the Clostridium botulinum. Now, this is a very common soil bacteria. If you go outside right now and you dig a hole in your yard, probably you're going to find some Clostridium botulinum right there. Now, what does this botulinum toxin does? The botulinum, folks, what it's going to do is that it's going to prevent the contraction of our skeletal muscle. It blocks the connection, the communication between the nerve, the sensory neuron, and the muscle cell. So what's going to happen then? Well, what's going to happen is that this individual won't be able to move muscle where Botox was injected. Let's take a look at this lady down here. This is the before Botox. Look at the forehead. And this is after Botox. Look at the forehead. It doesn't move. And because it doesn't move, it doesn't create the wrinkles. You know, when you look at the award shows on TV, like the Oscar or the Emmys or the Grammys, and you see those people walking on the red carpet, and you look at them, their face looks like they are paralyzed. Well, they are, because they have so much Botox injected in their face that they can barely move any muscle in their face. Okay. What about tattoos? Also very relevant when we're talking about the skin. I have a question for you folks, and the question is, into what skin layer must be deposited, the ink from a tattoo must be deposited in order to make the tattoo permanent? What layer of the skin?
Hypodermic?
No, not the hypodermis. The actual dermis. Okay? Now, imagine if someone just tattooed the epidermis, that tattoo would not stay there for very long. Now, on hindsight, there might be a good thing, especially if you tattoo the name of your significant other on your skin. And we know that 50% of the relationships end up in separation, in divorce. So it might be a good thing to tattoo their name on the epidermis. But in order to make tattoo permanent, that ink needs to go into the dermis. Okay? Now, luckily for you, if you regret that tattoo, there are treatments in which you can remove the tattoo, and that is by using a laser. Now, lasers are expensive treatment and they are painful. So again, think twice before getting that tattoo. Another condition related to the skin is something that we call the cubitus ulcer. And the cubitus ulcer is also what is called a bad sore. And it's something that we see very often in people that are bedridden. You know, people that are in a coma, for example, or the elderly that doesn't move a lot. And what happens is that if you take a section of your body, guys, let's say the elbow, okay? And you might have, felt this before. If you take your elbow and you put it over a table and you leave it there for an extended period of time, after a while, you're going to start feeling numb that area, right? So what's happening is that the bone is putting pressure on the skin and it's preventing the flow of blood. Now, what happens if you don't have blood supply to sections of our skin, folks? We are going to have the death of the tissue, the death of the cells. And that can lead to a bad sore or the cubitus ulcer. All right, moving on. Let's talk about the subcutaneous layer now, also called the hypodermis. And the hypodermis, it does contain some blood vessel, but we're also going to find a lot of fat, adipose tissue, and we're also going to find areolar connective tissue. So we have blood vessels, we have nerves, but we also have adipose and areolar connective tissue. Okay? Now, when you hear people that's saying, oh, you need to have a hypodermal injection, right? When you're having like a shot of a vaccine, for example, you need a hypodermal needle. What is a hypodermal injection? Hypodermal injection means that the needle is going to pass through the epidermis, is going to pass through the dermis, and it's going to inject into the hypodermis, okay? All right, moving on. Let's talk about accessory structures of the skin. What are some of the things associated with our skin? And we're going to take a look at some glands, hair follicles, and nail. Let's start with what we call the cutaneous glands. Guys, cutaneous glands are glands associated with our skin. All cutaneous glands are exocrine glands. Again, I'm going to repeat that. All cutaneous glands are exocrine glands. What does exocrine means? Exo means outside of the body, meaning that those glands are secreting something out of the body, okay, rather than in. If it was in, it would be an endocrine gland. Now, there are two different types of cutaneous glands. We have the sebaceous glands and we have the sudoriferous glands. What do sebaceous glands produce? Sebaceous glands produce what we call sebum or oil. And where are the sebaceous glands? Everybody look up here, please. This is important. It's going to be on the exam. Sebaceous glands are associated with a hair follicle. So this here, circled in red for you, is showing a sebaceous gland. And the sebaceous glands are going to use the little channels of a hair follicle in order to send the oil on the surface of the skin. Now, why do we have oil on the surface of our skin? Is it so that we look shiny? No. The purpose of that oil on the surface of the skin, folks, is so that we create a barrier to prevent water from escaping the skin. Remember, oil and water doesn't mix. So by having this layer of oil on the surface of the skin, it decreases water loss by the skin. It prevents the dehydration of our skin. Now, the sebum, the oil, also have inhibits bacterial growth. It has antibacterial properties, okay? Then we have the sudoriferous glands, also called the sweat glands. And sudoriferous glands, they have its own little channel, which is going to bring the sweat to the surface of the skin. Now, what is the purpose of sweat? Well, we're going to see we have different types of sudoriferous glands. We have the eccrine and the apocrine gland. But the main function of the sudoriferous glands is to produce sweat, which is going to help to control heat loss. Also is going to help to inhibit bacterial growth. I have a question for you guys that you should be able to answer because we talked about this in class before. Can anybody tell me how does sweat help to prevent bacterial growth? I'm going to give you a clue, okay? If you ever tasted your sweat, you know the sweat is salty. So my question is, how does sweat prevent bacterial growth? What kind of an environment does sweat create on our skin, guys? In the context of tonicity. Remember tonicity? We have 3 different tonic environments, right? What type of solution is sweat? Isotonic, hypertonic, or hypotonic? Come on, guys, help me out. You know this because we talked about it in class. And stuff that is going to be on the exam. So again, the question is sweat an isotonic, hypertonic, or hypotonic? I have 2 hypotonic here. Anybody agree or disagree? Sweat is not hypotonic. You need to go back to tonicity and understand the three different tonic environments. Sweat is a hypertonic. I gave you the clue, right? We know the sweat is salty, which means what? Which means that there's a lot of solutes dissolved in sweat, making sweat a hypertonic environment. Okay, not hypo, but hyper. And guys, again, this is the type of question that you're going to be seeing on the exam, okay? All right, now let's differentiate between acne and seborrhea, since we are talking about, sebaceous glands. Acne is due to an overproduction of sebum, of oil, from the sebaceous glands, and that is often due to an infection, a bacterial infection. So bacteria is going to grow on the sebaceous glands, and they are going to clog the sebaceous glands, and they're going to irritate the sebaceous glands, and that could lead to overproduction of oil. Okay, oftentimes acne is associated with skin inflammation. Now, seborrhea, also called the cradle cap, is an overactivity of the sebaceous glands, but do not involve inflammation. So oftentimes it happens, when a baby is a newborn baby, and we're going to see this, all that cap that is forming on the skin, often in the head region. And then oftentimes just by washing with the mild soap and warm water is going to remove that excess oil, okay? But there's no inflammation related with seborrhea. So as I mentioned earlier, we have two different types of sudoriferous glands. Now we're talking about, again, the glands that make sweat. All the sebaceous glands are the same, but we have two different types of sudoriferous glands. We have what we call the eccrine glands, and we have what we call the apocrine glands. And they differ not only where we find them in our body, but also the type of sweat that they produce. Eccrine glands are found all over the body. And they are active since we are little babies. A newborn baby, they have already active eccrine glands. Eccrine glands produce a sweat that is mostly water, 99% water, and also contains some sodium and chlorine ions in there, salt in it, okay? The sweat from the eccrine gland is acidic, and the main function of eccrine gland sweat is to help with thermal regulation and also, again, inhibit the growth of a bacteria. Now, where do we find apocrine glands, guys? Apocrine glands are found in the axillary, genital, and also in the areolar. It is different from eccrine sweat. Eccrine sweat is very watery and transparent because it's mostly water. But apocrine sweat is more milky. Why is that? Well, that is because it also contains a lot of fat and it contains proteins in it. Now, both of them, apocrine sweat and eccrine sweat, by themselves, they don't smell bad, folks. There's no bad smell in the sweat. Now, why does people have a body odor? Especially under the armpits and the groin region. And that is because bacteria is going to colonize the apocrine sweat because of all the proteins and the fatty acids. And when bacteria grow, that is going to lead to the odor. So the odor is not because of the sweat per se, but because of the bacterial growth on that sweat. Now, the function of the apocrine gland and the apocrine sweat is more for scent and chemical signaling. Okay, different from the eccrine sweat, which is more for thermal regulation. Any questions, guys? All right. Moving on. Let's talk now a little bit about the hair, also called the pili, which is one of the accessory structures of the skin. And we can divide the hair into different sections. So what is the anatomy of a hair follicle? We have what is called the hair shaft. What is the hair shaft, folks? The hair shaft is the section of the hair that is poking out of our skin. What we can see, the hair that we can see on the skin, that's the hair shaft. Then underneath the skin, we have a hair root, and all the way at the bottom of the hair root, there is something called a hair bulb. And within the hair bulb, we're going to find stem cells that allows the hair to grow. We all know that our hair don't grow from the tip. The hair grows from the roots, from the bottom right here. Okay? Now, if we take a single hair follicle and we dissect it, we open it up, we can see that the hair follicle is made of three different structures, three different layers. We have the outermost layer, which is very tough, and there's a lot of keratin in that layer. This is what we call the cuticle. A middle layer called the cortex, and an inner, very soft layer called the medulla. Okay. Now, let's focus on this hair bulb right here, which again is all the way at the bottom of the hair follicle. And before we get to that, I want to talk about a little muscle that we have attached to every single hair follicle in our body. And this little muscle is called the arrector pili. So what is the arrector pili? Arrector pili is a tiny little smooth muscle. We don't control it. And the function of the arrector pili is that it's going to lead to the erection of our hair follicles. So guys, when we have a goosebump, also as they say in Hawaii, chicken skin, and our hair stands up when we're watching a scary movie or someone scares us, that is due to the contraction of the arrector pili leading to the erection of the hair follicle. Now, scientists don't fully understand what is the function, the evolutionary function of the arrector pili, but one of the hypotheses is that, and we see this not only in humans, but other animals as well, like cats and dogs, when they are scared, their hair is going to stand up, right? And it's believed that there is a way to communicate danger with the other members of that group. So if you see something scary, your hair stands up, other cats or dogs are going to look at you and going to say, oh, there's a danger around. We need to watch out. Okay? All the way in the hair bulb, we're going to find a layer of cells called the hair matrix right here. And within this hair matrix, we have a lot of stem cells. Again, why do we need stem cells? These stem cells, they're going to divide very fast, and they're going to differentiate into other cells, allowing our hair follicles to grow. Within the hair matrix, we're also going to find the melanocytes right here, guys. Remember, melanocytes produce a pigment called melanin. And melanin is what gives the coloration of our hair. If you have dark hair, that means you have more melanocytes in your hair follicles producing more melanin. What happens when our hair grows gray or white? Well, as we age, the amount of melanocytes in our hair follicles are going to decrease, and the amount of melanin is going to decrease as well, causing our hair to turn gray or white. Okay? All the way here at the bottom, we're going to find this section, and this section is what we call the hair papilla. And within the hair papilla, folks, we're going to find a lot of blood vessels, and those blood vessels are bringing supply of blood to feed all the growing cells within the hair matrix. Guys, what happens when we color our hair? When you dye your hair, what you're doing is that you are using a chemical called hydrogen peroxide, and that is going to bleach and destroy the melanocytes and remove the melanin pigments. Okay. Taking a look at the nails now, and the nails are also divided into different sections, folks. Everybody look up here. The section of the nail that extends beyond the fingertip, this is what we call the free edge. The main section of the nail is what we call the body of the nail. Okay. All the way at the bottom of the body, we're going to find a little whitish section. That's what we call the lunula right here. And the lunula, right below the lunula, we're going to find a little layer of skin that helps to support our skin into our fingertip. And this is what we call the eponychium, aka the cuticle. And once again, I want you guys to notice right here that all the way at the nail roots, which is the section of the nail that we don't see, around it, we find a layer of nail matrix. What are these nail matrix made of? Stem cells. Once again, we know that our nails don't grow from the tip, right? They grow from the roots. And that is due to the division of those stem cells, the fast division of the stem cells. Now, what happens when we have a burn, guys? We're all familiar with the description of a burn, right? You might have heard of people having a first-degree burn, a second-degree burn, or a third-degree burn. What does that mean? Guys, the degree of burn is related to the layer of the skin that is damaged. If we only have the epidermal layer damaged, we have a first-degree burn. So I don't care what kind of a sunburn you have. A sunburn is only in the epidermal layer. Okay? Then we have a second-degree burn, and a second-degree burn is going to include both damage to the epidermis and the dermis. And a telltale sign of a second-degree burn is the formation of a blister, as we can see right here. And the blister is due to the separation of the epidermis from the dermis, creating a little bubble that is filled with fluid inside. And finally, a third-degree burn is due to the damage of all three layers of the skin: the epidermis, the dermis, and the hypodermis. And oftentimes, folks, a treatment for a third-degree burn is a skin graft that can either be from your own skin, and the doctor is going to take a device called the dermatome, and is going to create a little flap, a little graft of your own skin, and then is going to put over the third-degree burn to help it heal. Or we also have a graft from a cadaver, or a graft from that are artificially made, okay, to help with the process of healing a third-degree burn. Now, since we're talking about burn, let's talk about what is called the rule of 9. And I want to make a note right here, folks. You don't need to know this for the exam. But since you folks are going to go into the healthcare field, I do want to talk about it in class. Again, I'm not going to ask you questions about it in the exam. You don't need to worry about studying about this for the exam, but I do want you to be introduced to it. What is the rule of 9? The rule of 9 is to assess a burn and how to treat that burn. Okay, is a guideline for the treatment decision of burns. And what doctors have decided to do is that they decided to divide the body into different percentage. So if you have a burn, guys, in your skin, and it doesn't have to be on the entire skin, okay? If you have a burn, let's say right here on your forehead, the doctor is going to write down that the patient has a 4.5% burn in the body. If the burn extends from the forehead towards the back of the head, now you're going to have a 9% burn in your body. If you have a burn, for example, on one of your arms, you have a 4.5% burn in your body. So doctors then add up the percentage and the extension of the burn to make a decision how to treat the patient. Do we need to give the patient fluid? Because if you burn a lot of your body, you're going to lose a lot of fluid. Does that fluid need to be replaced? Do you need antibiotic, infusion of antibiotic? That rule of 9 is going to help with that decision. Okay? And finally, very quickly here, we actually are getting to the end of this chapter, folks, which means that we don't need to have a class next week, Tuesday. But let me talk about it in a minute. But when we are born, we have a very thin hair that's going to cover our entire body. And this hair is called the lanugo. And the function of the hair is to help to hold a waxy layer that a fetus have on the surface of the skin. And that waxy layer, it helps to protect the baby, the fetus, from the amniotic fluid, right? Because it's all the water. They're going to spend 9 months underwater. So having this waxy layer on the surface of the skin helps protect against that, all that fluid. And the lanugo helps to hold on to the waxy layer on the surface of the skin. Okay, most newborn babies, as soon as they are born, the lanugo is already fall off. But some premature baby, they have still lanugo all over their skin. Now we can also understand how the integumentary system starts to develop very early during the process of fetal development, right? Because the skin is what separates the internal environment from the external environment. Now what happens when we age, guys? As we age, we're going to have the thinning of our skin. Our skin becomes thinner and thinner, which leads to more cuts to the skin. We are going to have a baldness, which has a big genetic component to it. And the baldness is due to a slowdown of the growth of the stem cells in our hair follicles. And we're also going to grow gray hair. And that is because of the death of the melanocytes that are in our hair follicles. Okay? So they're going to produce less melanin. Does anybody have any questions? All right. So folks, we were able to finish the entire chapter 4 today. What does that mean then for you? Well, number one, I'm going to open the quiz for chapter 4. Okay, and the deadline for the quiz for chapter 4 is going to be the same as it is now. It's going to be all the way Tuesday night by 11 p.m. The quiz for chapter 3 is due this coming Sunday, which is already open, the quiz for chapter 3. The quiz for chapter 4 I'm going to open right now at the end of the class, and it's going to be due next week, Tuesday night. We don't have a class next week, Tuesday, because we were able to finish the whole chapter today. So I'm going to give you guys that time back so that you can take the time to study for the exam. Okay, so the next time that we're going to meet is going to be next week, Thursday, which is going to be the day of our first exam. I'm also going to send an email for the folks that are not here to let them know that. Any questions, guys? All right, so take that time. This is not going to happen very often from this point on, but take the time, study for that exam, folks. Start the semester stronger so that you're not always feeling like you have to catch up throughout the semester, okay? Start it strong. The first exam is the easiest exam. Why? Because a lot of the material is revealed. We talked about basic chemistry. We talked about cells and all of the stuff you should have known already. The only system that we talked about that's going to be included in the first exam is the system that we talked about today, the integumentary system. Okay, so prepare for that exam, and I'll see you next week, Thursday. Any questions, folks? All right, guys, have a great one.
Bye,
See you.
thank you.